We are running in an era of time where the cancer risk is real, cancer is reality, and cancer disease is probably the largest global epidemic right now that we are having. What we can do to actually play our part, first create awareness about the existence of this disease among masses, among our general practitioners who are the first contact persons for the patients, from the education that probably we want to impart to the population out there is first and foremost is to be aware of the signs and symptoms of common cancers. Breast cancer is the commonest cancer in women. Patients often hide their lumps and bumps for many years before they come to attention. They need to be aware that there is no shyness in being diagnosed. There are millions of cancer survivors out there only because their cancer was diagnosed at an early stage. Yeah, the cervical cancer is probably one of the most preventable cancers in the world. And a simple vaccine can prevent women from this devastating cancer, which when it is advanced is practically incurable. But again, cervical cancer itself is very curable entirety when it's diagnosed at an early stage. So early attention to your symptoms is something that we need to focus on. Men also need to be aware of the risks of lifestyle that are probably highly associated with cancers and which are often ignored, such as risks that are involved through smoking, excess of alcohol. Men also need to be aware of paying attention to the symptoms when they first arise. As a group, we all can contribute to reduction in the world cancer burden by adopting the lifestyle that is healthy, that involves exercise, maintaining an ideal body weight, physical activity that involves positive thinking, that involves thinking of seeking attention as well, as long as, unfortunately, if somebody has symptoms. Get vaccinated for hepatitis B. By that, at least you will be contributing to preventing yourself from a form of very aggressive cancer, which is liver cancer, which can be caused by an infection like hepatitis B. I wish you all the best. Stay healthy and take care of yourself. In our hospital, without incurring any cost, every physician can play a responsible role of identifying the patient who have the risk factors. I think the biggest gap is being in awareness and in acceptance. So that we can also do in our local hospitals without incurring extra cost. It's just making a little more effort. We have unequivocal evidence that smoking is responsible for many cancers, including top of the list being the lung cancer. So I think we need to make that effort and stopping and saying no to the habits that we know are putting you at risk.